The ADA is really clear in this report. The ADA reports that 38% of general dentists are experiencing overwork and overhead. 38% are experiencing that. Let's just round it up to 40%. Let's say it's 40% of the dentists that are experiencing this. That means 60% aren't. Now, I'd bet of that 60%, 20% of the 60% are having the practices of their career. They're making more money, they're enjoying themselves more than they ever have before. And so this is a real typical scenario of the haves and have-nots. You've got the dentists who are chasing the $39 exams, and you have another group of dentists that have adopted a completely different practice model. Instead of seeing 60, 70, 80 new patients a month, they might be seeing 10 or 15. Instead of emphasizing same-day dentistry, what they're doing is they're emphasizing complete care. The dentists who are thriving now are the same ones that thrived 10 years ago, 20 years, 30 years ago, and 40 years ago. The dentists who thrive are the ones who present complete care to all non-emergency adult patients. And they've learned to present it in such a way that even though patients may not be ready for complete care, they present it so well that patients never forget how well it was offered. And when patients become ready, they return to the dentist. That practice model, complete care over urgent care, okay? Now, I think what's really important to understand here is that complete care, that does not necessarily mean full mouth reconstructions. Complete care, the typical definition that you'll hear of complete care is restoring patients to optimal function, comfort, aesthetics, phonetics, and airway. Now, you can have a patient who just needs a simple two-surface composite and a cleaning, and that might be complete care for them because their existing dentition meets all those criteria. So complete care for some patients might be just a two-surface filling. Complete care for other patients, it might be a full mouth reconstruction. Where the problem resides is in the mindset of our profession. Because when they say complete dentistry is optimal function, comfort, phonetics, aesthetics, and airway, it's an incomplete definition. The complete definition of complete dentistry is optimal function, comfort, aesthetics, phonetics, airway, and relationship. Without relationship, without connection, without patients trusting and liking us, the first 5 criteria never happen. So is this a new phenomena? No. Is it a phenomena that's brought on by low-fee loss leaders, overemphasis of same-day dentistry? The dentists who are thriving, here's what the dentists who are thriving, what they have in common. Number one, they're well-trained. We've got some of the best continuing education in the world right here in the United States. Number two, they're all dialed in with the latest technology and they know how to use it, and they do use it. Number three, they got a team that's aligned. Everybody in the team understands the importance of connecting with patients. And number four, they know how to talk to patients. That's the big one.